What are the economic costs of secondhand smoke? What are the economic costs of secondhand smoke? This question reveals the hidden financial impact of tobacco use that affects more than just smokers. Secondhand smoke exposure is a serious issue that leads to both direct and indirect costs. Let's break it down. First, direct medical costs are significant. Treating diseases caused or worsened by secondhand smoke can be quite expensive. Conditions like heart disease, stroke, lung cancer, and respiratory illnesses are common among those exposed. In the United States alone, these direct medical costs exceed $5.6 billion each year. Now, let's talk about indirect costs. These costs arise from lost productivity due to illness and premature death linked to secondhand smoke. When people miss work because they are sick or when they pass away prematurely, the economy suffers. In fact, the indirect costs add at least another $6 billion annually. When we consider premature death from secondhand smoke exposure, it contributes to nearly $7 billion in lost productivity. This is a staggering amount that highlights the broader economic burden of tobacco use. Overall, the combined costs of smoking and secondhand smoke in the United States exceed $600 billion, with secondhand smoke accounting for a significant portion of these losses. Globally, the economic impact of secondhand smoke is also noteworthy. For instance, in Jordan, secondhand smoke exposure accounts for about 15% of the total economic costs related to tobacco use. This equals roughly 4.7% of the country's gross domestic product. Similarly, in Greece, secondhand smoke contributes nearly 9% of the total tobacco-related economic burden, amounting to almost 4% of their gross domestic product. The direct costs associated with diseases from secondhand smoke can strain public health systems. Treating these conditions requires significant healthcare resources, including hospital stays, medications, and outpatient services. Indirect costs reflected the economic consequences of reduced workforce productivity and increased disability or death among non-smokers exposed to secondhand smoke. From the perspective of substance abuse and addictions, these economic costs highlight the societal impact of nicotine addiction. Secondhand smoke exposure harms non-smokers, leading to preventable health problems and economic losses. This situation emphasizes the importance of comprehensive tobacco control policies. Smoke-free environments, smoking cessation programs, and taxation measures can help reduce both active smoking and involuntary exposure to tobacco smoke. Reducing secondhand smoke exposure not only improves public health but also alleviates the financial burden on healthcare systems and economies. By addressing this issue, we can create a healthier environment for everyone.